launch of the free healthcare, which offers free treatment to lactating mothers, pregnant women and children under 5. But faith-based hospitals were not covered by the scheme. There has been a mounting pressure on them from patients believing that they should administer free treatment. To temporarily address the pressure, the Catholic Community Hospital in Serabu District now offers a year-long free health care in that part of the country. Alimami Lahai Kamara traveled to Serabu to learn more about the free treatment.
Serabu in the Bompegao chiefdom is a large community inhabited predominantly by Mendes. Subsistence farming is the main source of livelihood there. The locals, in a humble lifestyle, live in stunted makeshift structures. Poverty seems to be conspicuous there, but does not prevent them from one thing: bearing many children. This is where they seem to be on top of situation. Childbearing is considered sacred, and that determines the strength and viability of the family. Many hands are needed on the farm. It requires quality medical treatment to raise children here to become strong farmers at least. The Catholic Community Hospital in Serabu seems to be administering that treatment, but it has come into conflict with the community. Patients believe that treatment must be free for children under 5, pregnant women and breastfeeding mothers. Government had adequately informed its people that those 3 categories of women must receive free treatment under the free health care initiative in government hospitals. Faith-based hospitals were excluded, and thousands of people up country did not understand that. Patients are being asked to pay. Religious hospitals are exposed to pressure then. The Serabu Community Hospital sits in the middle of the town, bounded by tall walls carpeted with low-shaved grass. The bungalow structures are architecturally positioned for easy access in times of medical urgency. The 250-bed hospital has a blood bank, outpatients, inpatient, labs, pharmacy, surgical wards, children, male and female wards. The hospital is next to the Bo Government Hospital in terms of size. People of Serabu and beyond would be happy for the introduction of the free health care in a hospital they consider as theirs. However, distance has been a challenge to the government free health care for those upcountry. Since government appears insensitive to that, faith hospitals are filling the gap. But they too, like government, are challenged with sustainability. According to Reverend Father Conte, Executive Director of Caritas, the duration of the Catholic free health care is 1 year to allow them to respond to the mass of patients streaming in for treatment. The bulk of medical supply is coming from Germany through support from retired German doctors.
We do it very short because we are here not for speaking, we are here for working and helping in this hospital. Our Grace, when we were introduced with you in January in Freetown, you said to us, the hospital in Serabu is very close to your heart. Now I can say it's very close to our hearts.
Father says negotiation is ongoing between government and the faith hospitals for a possible inclusion into the government scheme, which he believes could be long-lasting. The medical service covers outpatient and inpatient treatment, lab test, blood transfusion, and basic surgical operations. It is rich on this hand, but not rich on the other, since it has no impact on salaries of workers there. The hospital could risk losing some staff. Down the dusty road, some yards off the hospital, some parents were telling me their feelings about the new scheme. However, Reverend Edward Tambo Charles, Archbishop of Freetown, appealed to parents to come to the hospital for free treatment. For SLBC News, I am Aliwami Lahai Kamara.
Faith-based hospitals were not covered by the government's free health care initiative. Well, to help us talk more about that, I have just been joined in the studios by Reverend Father Peter Conte, who's the Executive Director of Caritas. Good morning and welcome to News Hour.
Good morning.
So why are you only starting the free health care now when the government started theirs about 10 months ago?
Well, the government launched a free health care for government facilities, and the faith-based hospital apparently were left out. and we're in a situation wherein apparently our role is to help the poor. And we realized that the rural people could not understand why they were not included in this scheme, and we were faced with this challenge, so we had no alternative but to find our own way to help these poor people.
So I just want to know the essence of this good gesture of joining the government in doing this free healthcare for especially those in Serabu.
First of all, I want to stress that we are just complimenting the effort because it's a positive thing to help our people. And we as faith-based, our objective of running a hospital is not profit-based, but to help with the healing ministry of Christ in our own case, to help the sick people, particularly the poor. That is why our hospitals are located in rural areas where people cannot afford health. And now we realize that government has limited their scheme initially only to government hospitals, and we see ourselves who have the fundamental tax to help the poor being charging the
So why is it that faith-based hospitals were not included in the free healthcare service?
Well, initially we asked government why we were left out. They said, well, it's an initial stage. They are just testing and will be included. Well, we've been on the dialogue for quite a while now, whilst the people are left suffering. So we felt we have an obligation to help and complement this positive effort.
Okay, so how will your own free healthcare work? Because the government yours is different from the government, right?
Yeah.
The government's free healthcare. So how definitely this will work for especially the people in Serabu?
Well, the nearest government hospital is in Bo, and you are talking about poor people who can't even afford transportation to go to Bo. There are PHUs that they give limited supplies, but that's not enough. And we have this hospital there, and so we felt we just have to come in and help.
Okay, so the duration for this free health is going to be 1 year. So what will happen if government refuses to intervene or help you guys out?
Well, by all indication, government has assured us that they are going to include us in the second phase of this scheme. But meanwhile, we are just assisting meanwhile. We've had several meetings. We belong to an association called CHASUL, Christian Health Association. And as a group, we've had meetings with the ministry, and we've been promised, and we are hoping that government will keep to their promise. So we are just helping for a year, and hopefully we sure government will keep to their own
now,
promise.
do you think this will be successful? Because if we talk about how other nurses or doctors who are working for government hospitals, because definitely the conditions of service is definitely different from the Catholic hospitals. So tell me exactly how will this work, your challenges?
Well, first of all, the free health brought a lot of challenges to us. You know, government increased the salaries of their workers, and so it was difficult to retain our own workers. They left for government hospitals because now they were paying higher than us. So we are stuck. And so that's the biggest challenge, that we can't retain our workers. And we requested, can government, even if we are not included in this free health scheme, can they help to subsidize even the salaries of the workers? But that has not been possible. So that's the biggest challenge we have in this good scheme. The idea about free health is good, but apparently there are negative effects on us who are faith-based hospitals, who are not private hospitals. Private hospitals are hospitals intended for profit making. Our faith-based hospitals are geared towards helping.
So what are
poor.
some of the services that this free health will offer to people in that part of the country?
Well, ours will certainly be a unique one because we reflected on the lapses on the government free health.
What are these lapses?
And we included inpatient, we included blood transfusion, surgical operation, ultrasound, are absolutely going to be free. And we realized that in those communities it's difficult to convince the people, first of all, to come to a hospital. So they leave their villages and they come, and we will also help with food for not only the patient but those who are bringing up the patient.
So after 1 year, if the government refused to sort of complement their own effort in helping you guys out, how will this impact on the lives of the people there? Because they've been used to not paying now, because this scheme started in February, 1st of February, and it will end on the 31st of December this year.
I am very positive that government will certainly help, because fundamentally, health is the responsibility of government. You know, we come in with education and health, not to duplicate what government is doing, but they have the fundamental right. The people of Serabu, the people of Bumpe are also citizens of this country. Why should they be omitted? So I'm positive, and we are going to give the necessary pressure to government to give attention to this situation.
And what is the attitude of the people with regards to this free health?
Oh, they are delighted, because apparently they didn't understand why they were left out. You know, it was difficult to explain to them. You know, Serabu used to be a very famous hospital, but it was destroyed during the war. Okay. And thank God to the EU, they helped us re-establish the hospital again. So we are running the hospital on a cost recovery basis, very minimal charges. But yet the people are very, very poor, and now they are coming, it is announced it is free health. How can you explain to an ordinary man that, oh, you are not included? So when we launch out our free health, it was good news, and the whole chiefdom and the whole surrounding, it was really, really good news.
So are you saying you've seen the increase of people? Drastically.
In fact, our biggest challenge now is how to cope with the number of people that are coming. But we've pre-positioned ourselves to fight against our challenges.
Okay, thank you very much. He is Reverend Father Peter Conte, Executive Director of CARI.